Okay, hello everyone, and welcome to today's Policy Lab with Al-Shabaka. I hope you guys are doing well, safe, and healthy in these times. Today we will discuss the issue of the Palestinian leadership in the time of the pandemic. Today's Policy Lab is a bit of a special one. It's part of Al-Shabaka's wider efforts discussing the issue of the Palestinian leadership, accountability, where we bring together a number of Palestinian policy members to analyze, discuss, and think of how Palestinian leadership can be representative, democratic, and accountable to the Palestinian people. And against this backdrop, today we will discuss the Palestinian leadership's response to the COVID-19 pandemic in Palestine and the resilience of the Palestinian Authority, the efficiency of its governance in a time of crisis. And we will discuss and examine the current emergency measures in the West Bank and their ramifications on the Palestinian people's trust in the leadership. We will also look at the connections between the Palestinian Authority's past public health policies and their impact on their current response and capacity to deal with the current pandemic. Today, I am joined by two colleagues. We welcome today policy member Mohammed, Dr. Mohammed Al-Khaldi. Dr. Al-Khaldi is trained in public health policy. Over the last 13 years, he engaged in 3 different sectors, serving at the government as a health policy researcher, performing teaching activities and conducting research, as well as leading NGO health projects and programs. In 2018, he obtained his PhD from the Swiss Tropical and Public Health Institute in Switzerland, where he succeeded to pursue a critical system analysis of the Palestinian National Health Research System. He worked with many international institutions such as the World Health Organization, Council on Health Research for Development, Health Systems Global, McGill University, and Swiss TPH as a health consultant and scientific collaborator. His areas of interest are health systems, health policy, and systems research, evidence-informed policymaking, knowledge transfer and translation, and health and development programs management. Our second speaker for today is Fadi Quran. Fadi is also Al-Shabaka policy member. He's a senior campaigner at Avaz and a popular struggle community organizer. He previously served as a UN advocacy officer with Al-Haq's legal research and advocacy unit. And apart from his work on advocacy and international law, Fadi is also an entrepreneur in alternative energy field, where he has founded 2 companies bringing wind and solar energy to Palestine and other countries in the region. My name is Marwa Fatafta. I am the facilitator of today's discussion. So diving in right into the topic, early on in March, when the first cases of COVID-19 were discovered in Palestine, the Palestinian Authority moved very quickly. President Mahmoud Abbas announced emergency measures, and much earlier to many other countries around the world, here in Europe where I live, or in the region. So I will start with Fadi with the question of how do you see the response, the emerging responses, and how do you think the Palestinian Authority has handled the pandemic so far?
Thank you, Marwa, and it's a pleasure to be here and to be discussing this important issue with everyone. So thank you guys for joining. I think where we need to begin is by giving credit where credit is due to the Palestinian leadership. From the beginning of this crisis, the leadership basically followed the science, which is more than other leaders such as Trump or Boris Johnson in the UK did. And that led them to close down very early. They followed the general pandemic guidelines. There are a certain set of steps that have been established by the World Health Organization and others, such as how to move towards testing, what to do when there's community outbreak, that the Palestinian Authority followed step by step, and they put health as a priority within society compared to other countries which, whether for political reasons or economic reasons, did not put health as the top priority. And I think what's also key here, and that was also commendable, was the early risk communication that happened from the Palestinian leadership, particularly from Prime Minister Shtaya, who got on TV and spoke about specifically what the threat was, what needed to happen, and gave people a general context as soon as there was an outbreak in Bethlehem. I think here, what's important to also note is that based on research I've conducted last year in 2019, a key person, the Palestinian security forces actually had requested that there be a simulation training for pandemic in case of a SARS outbreak. So whoever this person was, they're actually the real hero in this situation from my perspective, because they had the foresight to say, let's have a simulation training in the event that a pandemic happened. They did that, they got expert support, and so they were ready. And that's a very good sign. I think where we also need to then shift quickly after commending the PA, it's an example I like to give. It's as if, a mother has a son who's consistently failing in high school, and one day they come home and they get a 9 out of 10 in a quiz, and so you're very happy. But it's important to highlight that the PA's early response, the 9 out of 10, let's say, does not represent, unfortunately, the broader type of response that is needed in this circumstance. For example, a point that I think Mohammed will be better able to speak to is the issue of Palestinian healthcare. One of the reasons we had to close so early and institute a hammer, and people had to, really stay at home for a long time, is the Palestinian healthcare system is just broken, pretty much. It has no capacity to deal not only with a pandemic, but even to deal with increased Israeli aggression against Palestinians, and even to deal with normal health situations. And where I want to kind of end this point to answer your question, Mar, was also looking ahead and being nimble. If we look at the PA's response, they followed the guidebook provided by the World Health Organization in terms of closing down, but on issues that are specifically Palestine relevant, that they should have also prepared for, where they should have been creative and taken the initiative, they're failing. One case is the case of Palestinian students and other Palestinian citizens who are stuck abroad. The PA still has no plan to return them to their homes. Many of them are suffering financially and health-wise. The PA should have had a plan to return all of the Palestinians, particularly the students and vulnerable communities stuck outside, to their homes. And another example that the Palestinian Authority should have prioritized is the political prisoners. And again, the PA did not have a plan in terms of how to support political prisoners on that front. And where we need to start thinking about in terms of this crisis is, and we'll speak to this later in the conversation, is where do we go from here? Do we stay within the status quo where we're extremely vulnerable to this pandemic, or do we move to a better place? And I think the real leadership that we should also commend is the leadership of the Palestinian people, because the communal support networks that were built have been much more effective even than the government humanitarian efforts that have been conducted. I've seen Palestinian diaspora supporting people locally, communities supporting one another. Similarly, people have followed the health advice in terms of hygiene. There's been a lot of local efforts to ensure that everyone has access to healthcare, even in places where there isn't direct government intervention, such as Area C. And I think the Palestinian people and their leadership is the key at this moment.
Thank you very much, Fadi. I mean, today, in the beginning of this discussion, as you mentioned, we're going to examine the current response, and then we will go into how the past policies affect today's response. And you mentioned the issue of the public health system. And then we will move into how can we reimagine and what lessons can we learn from how the Palestinian leadership handled the current crisis looking into the future. We will move to Mohammed and then also look at the responses beyond the Palestinian Authority. What was the role of the private sector and NGOs, international organizations in this pandemic?
Thank you so much, Marwa, and welcome all of the participants for this webinar, and thank you for the Al-Shabaka team for organizing this critical policy analysis tackling the current pandemic. So let me comment on the position or the comments that raised by Fadi, that the role of the state actually was really reactive rather than proactive, and we want to talk about that because early predictive or preventive measures taken by Palestinian government authority reflect effective decision making, especially in comparing with the other countries in the region. So implementing lockdown measures after that has been thousands of confirmed cases, it was really successful and the right decision. But for nevertheless, decisions actually taken in the Gaza Strip in a different way. So we don't have a unified decision-making approach, and even the strategies that are implementing on the ground are not really aligned with in East Jerusalem. So let me come to the role of the non-state and the private sector. The role of non-state actually remains minimal, specifically when it comes to the implementation and the preparedness, and also resource mobilization and allocation, and the response measures actually was really very limited from the non-state actors and the players, especially from the international agencies, with an exemption to the WHO, World Health Organization, where they provided technical and logistical support to the Palestinian authorities and even the health authorities in the Gaza Strip. So there an actually increasing role in the private and NGO hospitals in the health system in Palestine, but in certain situation or the current situation, we haven't seen that major role coming from non-state organ. Maybe because the Palestinian Authority government they didn't give them the chance and the opportunities to play a key role in this pandemic. So a harmonized collaboration between Palestinian government, BA government, private sectors, NGOs, and even CBOs, community-based organizations, is inadequate during this pandemic or responding to this pandemic. And I think according to the WHO guidelines or strategic direction, the whole government, including the communities, the leaders, the organizations, and all of the private sectors and institutions must act collectively. And we have a priority that to tackle and to respond to this kind of pandemic, that we need community-centered approach, that all of the players comes together in one strategy and one act and even one goal. So the non-state organizations and roles are really limited, and we can make a clear statement that this role should be actually promoted and reinforced from now and for the future as well in the future crises and events.
Thank you, Mohammed. I would like to remind our listeners that if you have any questions, please leave it to us in the tab, Ask a Question, and we will address your questions in the last 30 minutes of this Policy Lab. So going back to the topic of a government response, Fadi, your point on the Palestinian Authority's response to the pandemic and how quick they reacted, and them doing fairly well despite previous failures in the past. I mean, how government responses to the pandemic has been a discussion worldwide. I mean, looking at the Trump administration's response and looking at how the UK had responded and the effect of that on the population and people's public health. when we talk about Palestine, there is we are indeed a unique case with different specific factors to it. I mean, we live under military occupation, and we are moving from one crisis to the other. So in this case, how do we imagine, or what would the, let's say, the leadership under crisis should look like?
Thank you, Marwa. And that's a very good question. I think the key point here for the audience is that Palestine is under constant crisis, right? Even before the coronavirus approach came, or kind of pandemic started, we had 25% unemployment rate across the West Bank and Gaza. We had a collapsing healthcare system. We had levels of poverty that we don't have any accurate numbers, but they range from some 20% to 40%, sometimes higher, depending on the situation. We had house demolitions and arrests happening. And there's a question here, I think, that we need to begin and just put on the table, which is, why has the way the Palestinian leadership dealt with this crisis been so starkly different from how they have dealt with the existing crises that Palestinians face? And there's, I think, a general consensus here that the big crisis, the occupation that we face, the PA is not really interested in significantly altering the status quo. And it's a place where they do not take proactive measures to lead and to help fix. Whereas COVID-19, there's a tacit, maybe unspoken interest between the Palestinian leadership and the Israeli leadership and regional leadership and global leadership that every country should deal with COVID-19. And so it was much easier for them to move on this front than on the bigger crises we face. But in a moment of crisis, there are kind of 5 pillars that leaders should follow. The first is acknowledging people's fears and then encouraging resolve. And I would say that from the way the Palestinian Authority has led with this crisis and other crises, they have not really acknowledged or empathized with people's fears. And more importantly, they have not really encouraged significant resolve. It's more, they've always sought to focus attention. Let's give the example of this crisis on the Palestinian security forces, who take a significant chunk of Palestinian resources, who play a role in coordinating with Israel. There was no conversation, even if you watch Palestinian national television, you see a significant amount of the gratitude goes to these security forces, 10 or 20 times more than goes to doctors, than goes to the people on the front lines who are supporting their communities. So there's not really a societal encouragement of resolve. And then also, they haven't spoken to the broader Palestinian community around the world, which are 12 million people. It's largely been West Bank, sometimes Gaza focused. The other role of leadership in a moment of crisis is to give people a role and a purpose, right? The greatest leaders in history have all dealt with crises. And what they do is they try to mobilize society to build a better future and give every portion of society a role to play in this front. In this crisis, what we have seen is that the main focus has been to go back to the kind of Oslo status quo, which, as we were saying, is a crisis status quo for Palestinians, where we are continuing to pay a high price every day. In fact, the amount of people killed by Israelis on average over the last year per month is higher than the amount of people killed by the coronavirus or even injured by the coronavirus in the last few months. And that's kind of an important comparison to make in this case. Last but not least, there's the importance of adapting boldly when one leads during crisis. And what this means is that you try to get ahead of the changing circumstances. As Mohammed was mentioning, the PA has been reactive. They haven't been proactive in getting ahead of the crises we face. There are certain things like an economic recovery that we need to start thinking about. And Israel is now, as Palestinians, we don't have our own currency. We cannot take loans from the IMF. And so consequently, we need to rely on foreign donor aid. But do we really? Is there a possibility to move towards actually building a type of local bank, a type of local financial system that will make us more resilient to these types of shocks? And where I think this conversation needs to then go is the conversation of what is the impact we're seeking. Leadership through crisis is about engaging for specific impact. And in this case, where do we as a Palestinian people want to go after COVID-19 is finished? What are the things we want to rebuild in our society? There has been no conversation about that and engaging on impact in that front during this crisis. And this leads me again to speak about we try to be fair in terms of the good steps that the PA has taken, but we shouldn't set our standards low so that when one step is done well, we ignore other steps. I think there's an issue of transparency here that we still need to ask. For example, we need to compare the amount of deaths generally in the last 2 months to the average amount of deaths that have happened in the same months in 2019, 2018, because that will give a more holistic picture about the spread of the COVID-19 virus. That transparency is not there. Those who've tried to get those numbers haven't been able to receive them. And I'll end by saying that scientists are all largely in agreement that COVID-19 is going to be with us for the next 18 months, 2 years, maybe more, until we find a vaccine and an effective solution to it. And how are we going to deal with this crisis as it unfolds, given that Israel is adding more crises on our fronts? They're preventing banks from giving money to the orphans of martyrs and political prisoners, another punch to our economy. They're planning annexation in July, and we still don't have a vision, not only for how to deal with COVID-19 in the future, but also how to deal with the occupation and the crisis that it's enforcing on us every day.
That's a very valuable insight, Fadi. And I have a follow-up question, actually, to a very important point you mentioned, is that there's a lot of question marks. I mean, some of which we're trying to answer in this policy lab, but there is a broad conversation to be had about the aftermath of this pandemic and going back into the roots of the leadership crisis. It didn't start with COVID-19 pandemic, as we all know. The roots of it was way longer. But then, how does that conversation look like, and how, as Palestinian people, should we organize and have similar the conversation you mentioned? What's your vision? How should that look like? How should we organize for it?
I think, thank you for that question, Marwa. And the way we need to look at our current situation is one where it's not about top-down leadership. It's about grassroots leadership. And every Palestinian should feel a responsibility to redefining our status quo. And I think this crisis, the coronavirus, also is a huge opportunity because it's allowing for a rebirth and a rethinking, not just of what Palestine will look like after, but what the world will look like. And my vision for how to do that consists of two balancing aspects. The first is that we should engage in these types of conversations that we're having right now, but on a broader and broader scale within our communities. And so we need to have a list of questions. What's the future we want to see in Palestine? How are we going to build power to be able to effectively challenge the occupation? Who are our allies? What are our strategic strengths that we can move on? And so that conversation needs to happen on one side. And then crises are largely held by and controlled by those who take initiative. So going past the conversation and vision and actually experimenting on the ground in terms of how can a village, let's say the village called Jabal al-Baba in Area C near Jerusalem that is being threatened by being destroyed by the Israeli occupation, how can that village be strengthened and made resilient, and to begin actually taking steps on the ground to do that? How can we have elections? There's a big conversation now about elections in the time of coronavirus. Can they be done electronically, for example? Can we do those types of elections for Palestine, creating a new online system so that all Palestinians can vote? And I think if we do those two things, which is we push for conversations on the community level and then connect them across the Palestinian areas of existence, and at the same time experiment and move forward on certain solutions with a focus on resisting the status quo, we'll be able to transform this crisis into an opportunity. And I think the Palestinian people, where I'll end is, you already see sparks of this. I look at, for example, a group of young men and women who created a group called Nas Labadha, People Are For Each Other, back in Palestine. And they're collecting aid locally and globally and providing it and distributing it to hundreds and hundreds of people, creating a whole new network of support that never existed before. Kind of like the first Intifada. I see the Palestinian diaspora probably the most organized and energized since the last 25 years, sending money back home, and different groups doing that, sending hundreds of thousands, millions of dollars back homes. So these networks, I think, instead of letting them die as the coronavirus kind of fear level dies down, we should build on them to create a movement that can bring us to liberation. Because if we just count on the current leadership that exists, their interest is not in building for the future. Their interest is returning to the status quo of the past. And that will only keep us under the boot of the occupation.
Thanks, Fadi. I think we lost Mohammed, but while we try to get him back, there is one last question on the diagnosis, so to speak, of the current situation that is throwing into the mix of the crisis the geographical and the political divisions and fragmentations that we're living under. So what has been the responses, or how has the crisis exacerbated these divisions between Gaza, the West Bank and East Jerusalem, Palestinians living in the occupied territories, and Palestinians living in Israel, or citizens of Israel? So how has the crisis brought even forward these divisions further into the front scene?
One way that these crises have expanded now is that the shutdown has kind of doubled. Israel had already forced a fragmentation of Palestinian society through different coercive measures. Now, even the smaller links of engagements between Palestinians in those different areas have slowed down completely. And this has led, if we look at how Palestinians are dealing with this situation, you have one response that's focused on the West Bank, another response that's focused on East Jerusalem that is being extremely curtailed by the Israeli military. They've even closed down some clinics doing testing for Palestinians because they do not want any form of Palestinian sovereignty in the city. And that's why Jerusalem, by the way, has, of all the cities in Palestine, has the worst case. The East Jerusalem has the highest level of cases. People have been arrested. I think it's important for our audience to be aware. People who have been working on helping get tests and supporting people who have COVID-19 in East Jerusalem, many have been arrested and harassed by the Israeli occupation. And then you go to Gaza, which has its own de facto government, which has received some support from the PA, but who are dealing with the issue separately on their side. There's not a lot of full transparency there in terms of what's happening, but fortunately the caseload is low. In 1948, within Israel, the Palestinians there are facing discrimination. They're not getting the same amount of treatment and care. And in the diaspora, different communities are suffering to kind of find their own ways. Particularly, I want to note for our audiences here, Palestinian refugees in Lebanon have a horrendous situation. They've consistently faced discrimination. But now there are Palestinian refugees from Lebanon who had gone to study in places like Germany, Ireland, and so forth, who are being banned from returning. So when the Lebanese government brings back Lebanese citizens, it's not allowing Palestinian refugees to return to their homes with them as well, creating this limbo situation. All this to say, I'm describing these different fragments because what is lacking is, again, the Palestinian Liberation Organization should be a body that goes and represents all Palestinians and has a strategy to deal with the whole Palestinian people wherever they exist. Currently, it looks like the PLO is dead. It looks like the PA took responsibility for the West Bank, Hamas took for Gaza, certain political parties in Israel. And there's no attempt to move this forward. And this is a danger because there's a concept in social sciences called path dependency, which is if there's no body that unites Palestinians in one strategy, in one vision to fight this fragmentation, each group of Palestinians is going to be forced to move in its own direction of establishing its own institutions, its own processes, its own allies. And what that leads to is further breaking apart, further moving apart, instead of coming closer together. And historically, it was the PLO that brought us more closely together. And the lack of that happening right now is a dangerous sign for what can come to the future, because it's an Israeli strategy to disband and to expand the fragmentation of the Palestinian people. I hope that kind of helps answer the question here. I think, given for our audience, I don't want to end on the kind of depressing note of the lack of efforts by the PLO to connect us all. I want to say that Palestinian people have a responsibility to build those frayed networks. And what I have seen again is, despite the PLO being MIA, Palestinian people, despite the fragmentation, have come and supported each other more significantly than the last time I've seen this type of unity was during the last Gaza war.
Thanks, Fadi. Yeah, I mean, you brought in the question of the PLO as well, and the missing role of the PLO, of not having that umbrella body that represents all Palestinians, particularly in this crisis. And early on, you mentioned also Palestinians who are Palestinian refugees, who don't have access to health in normal circumstances, let alone in a crisis where there isn't enough tests and emergency help for, let's say, for the population in Lebanon. So in this case, of course, refugees are deprioritized in these countries. And I mean, it seems like we lost Mohammed. And we are now at the mark of 30 minutes until the policy lab ends and we go into questions and answers. So perhaps we should continue from your conversation into what we need to do. And in that context, there are two important issues. One is that what is our exit strategy for the time being? A lot of countries around the world started to loosen their lockdown and emergency measures and trying to open up public life, opening restaurants and probably schools. And there are thinkings about giving some fresh injection into the economy. And so what would be or what should be the exit strategy in the short term for Palestinians and the Palestinian leadership? And then looking into what you mentioned in the long term, what are the lessons learned that we need to consider as Palestinian people and also as Palestinian leadership into really having that much needed representative governance system or a leadership that answers to all the questions that you've raised, the issue of fragmentation, the issue of lack of representation, the issue of elections. I mean, there's a plethora of problems that we need to tackle, both leadership and people, to go beyond that current impasse that we've been living under for the last pretty much, I mean, since the start of Oslo, so for the last 25 plus years.
Yeah, so I think to begin by speaking about the current, what's next, the kind of midterm period before we think about the long term. The audience and a lot of the scientific consensus, I think our audience may be aware of this, is that as countries reopen, the World Health Organization has recommended three things to look at. First of all, the general epidemiology. The question, is this epidemic controlled? And there are certain factors that can highlight that. For example, are the cases consistently decreasing over the last 3 weeks? The other question that then comes is the health system. Is the health system able to cope with a resurgence of COVID-19 cases that may arise in the future? And they likely will arise, right? If Palestine is very tourism dependent, one of the key ways that we will need to reboost our economy is to slowly open up the tourism sector. With that comes the risk again of people entering with the virus. And then there's public health surveillance, which is the system we have to see how many people have the diseases capable of actually catching an outbreak when it happens. So the recommendation has been what's called the hammer and the dance. Essentially, the hammer is that once you begin to see a resurgence of the virus, you go down very hard and you just shut it down, by lockdowns, by taking many different quarantine steps to ensure the virus doesn't spread. And then once it stops spreading, you start dancing with it. So you start opening up slowly. And if it goes up too high, then you again use the hammer. This is what we're going to see, not just in Palestine, but in most countries around the world as we move forward. In Palestine, the big danger in the midterm that I'm seeing is the question of our health system. We've had to be so strict. It's not just the kind of visionary leadership of, Mohammed, the prime minister, that led to closing down fast. The real reason we had to close down fast is any leader, any person, anyone listening here, if somebody came and told you there's this virus spreading, you only have 300 to 500 working ventilators in your country. If you don't close down right now, within 2 weeks, the ICU beds will be completely shut down. And you already know your hospitals and the amount of healthcare workers you have are not capable of barely handling the current. Unless you are a sociopath or psychopath, you're not going to open up things. You're going to close very much. And I think where the investment needs to happen in the midterm is how to rebuild our healthcare sector, what to invest in. We have experts like Dr. Mohammed and others who can speak specifically of what to invest in. And the other aspect of looking into the midterm that's super important is different malicious actors always seek to use, it's the shock doctrine, always seek to use moments of uncertainty, moments where the world is looking in another direction to win their certain policies. And I think for us as Palestinians, annexation or a certain example of it is going to happen within the next few months. We're also going to see the new Israeli government try to win certain aspects that it has sought to control for years, such as shutting down current, efforts of popular resistance in Palestine, taking more areas in Area C, increasing the siege on Gaza. And in the midterm, we as Palestinians, apart from just thinking about COVID-19, need to also think about what are the opportunities that we're going to jump at and how are we going to face the Israeli challenges that are being put in front of us. And one thing I would say, for example, at this moment that the PA should be campaigning hard for is the release of the over 200 Palestinian children currently held in Israeli prisons where there have been COVID-19 outbreaks. This should be a priority on the leadership's table, mobilizing all of their efforts to get these children out of prison. And another example is pursuing accountability for different actors. But given that Mohammed is back, I think he can answer some of the questions better than I can on this front.
Thanks, Fadi. Welcome back, Mohammed. Great to have you back. I kind of lost hope we will have you again, but I'm very glad you're back. So Mohammed, you are an expert on public health, and you can give us this unique perspective of the PA's past public health policies. I mean, Fadi mentioned an important point. Whenever the PA's response to the pandemic is discussed, a lot of people say, well, they have no other choice because they know, as you Fadi mentioned, that the hospitals and the emergency care and the number of ventilators wouldn't even allow them to contemplate not thinking or responding otherwise. So, Mohammed, can you give us an overview of what is the problem with the Palestinian health system, and looking into the future, because this is where we arrived in the conversation now, how should we strategize? What is the leadership role thinking into fixing the weaknesses and gaps in the current system, and how can we reimagine a health system that is fit for a population that is under constant crises and living under violence and occupation. And I think that's very important to keep in mind, that the Palestinians are subject to everyday violence that requires a system, a health system that responds to their needs. So the floor is yours now. Great.
So, well, actually, we have seen severe, constant major gaps over the last 20 years at least. So that where we are, the government were not addressed, I mean, the successive governments, that they didn't actually address the key issues that that I'm going to mention. One of these major gaps or obstacles, the lack of governance and the stewardship. So we don't have really clear accountability, transparency system that actually provide sharing information, having the policies based evidences, and acting as a collective approach rather than individualism or individualistic efforts and policies at the national and even at the local level. So the second gap is the severe shortages in resources and capacities. So we have seen in this crisis really chronic health workforces capacities. So this was actually clear opportunities for the private and even the NGO sectors to mobilize their manpowers and workforce to be involved in the government response strategy and the plan. So again, we don't have really financial sustainability. So most of the funding coming to the health sector are really donor dependent and reliant on the international assistance and development aid. So another issue is the capacities. The capacities of the health system over the past 20 years are really degraded, and it became weak because you know the resources already depleted, and the attacks from the by the Israelis over the past years, the financial instability, the political instability, political divisions, institutional and administrative split it between Gaza and West Bank. So all of these, along or on top of that, the governance and even the policies. Uh, we have seen weak cooperation and collaboration and even the partnerships between the stakeholders, all of the stakeholders in Palestine. So when it comes to the roles of the stakeholders, we, no one actually knows the key roles, that most of the roles and responsibilities are remained undefined. So we have to define the roles of each partners, of each actors, what to do actually in the current situation and even for the future. So the strategy for regulating the roles and the responsibilities of the stakeholders is really imperative in this regard. So lack of investment, we haven't seen real investment and really major investment in the public health system over the past, and even in research. So the political will and commitment is really weak for the issue of the health investment and raising the expenditure and the total public budget for the government. So we have seen really a big share for the security rather than the health. So what is what we're facing now? It's the consequences of yesterday's problems and causes. So now it's a time to act in different way, to rethink in different way, to reshape our public health system, including all of the stakeholders, in order to get well regulated and harmonized health system to be able to respond to the major events and responses. Because we are actually living in an emergency and even unstable situation. So we have to learn from this emergency on and this pandemic for the near future and for long term in order to be well really resilient and well prepared to respond to the such as pandemic or other emergency events.
Thanks, Mohammed. Thank you so much, Fadi and Mohammed. I think we have 15 minutes and we have some questions to answer. Okay, let me think how we can do this. I will ask the question and I will assign it. I'll be a dictator and just assign it directly. I think that's most efficient in terms of time we have. Okay, so the first question is, how can the exit strategy that has been explained work in the Palestinian context where there is no sovereignty, no social safety nets, thousands of Palestinians working inside of Israel, etc.? I guess this question is for you, Fadi.
Yeah. So that's a good question, and I think that's the exact type of question that is what crisis leadership is about. It's in terms of experimenting and evaluating what is possible and what's not possible in this moment. But I think the key bit is to not think about Palestinian agency through the lens of Israeli restrictions. So, for example, one key opportunity I think we have now in the West Bank and in Gaza is to think about, in terms of local redistribution of finances and the resources that exist today. There hasn't been a real analysis of the Palestinian budget and where the money is going. But it's very clear, for example, that we have certain entities that are monopolies, such as Paltel, which is the Palestinian telecommunications company, that makes tens of millions of shekels in profits. Now, there was and they're allowed to be a monopoly by the Palestinian Authority that has consistently expanded their contract. Now, there's a question here, right? This entity is making a lot of money. The PA's response has been, let's create a donation box and give it a nice name, Waqfat Iz, and tell rich Palestinians or these types of companies to put as much money or to put some money in it as possible. That box has collected, 60 million shekels. Not bad. But if the Palestinian Authority had redesigned and basically done what other governments are doing, taken some money from these kind of government monopolies and put it into societal support, we could redesign our whole financial system to ensure that it's much more equal and much more resilient. That's a step that can be taken, and we don't need Israel's permission to do it. And I would argue would make society better off because it would decrease inequality. In terms of the issue of political prisoners, for example, UN Secretary General Antonio Guterres has called for a global ceasefire. And I think so far about 18 government and non-state actors have committed to this ceasefire. Israel is one of the very few that has not agreed to this ceasefire and continues to arrest Palestinians. There are steps that can be taken right now to basically put Israel under the spotlight on this front that the PA could mobilize towards. That would help the issue of the political prisoners cases. There are other similar steps, and this is not the conversation to go into details given the short amount of time. But the answer to your question is Palestinians have agency despite the cruel restrictions that Israel imposes on them. And that's why we should use this agency. The PA alone won't move in this direction, largely because they have interests intertwined with not creating friction with Israel and with not creating a more equal economic situation on the ground. And that's why it's up to us to pressure them in that direction.
Thanks a lot, Fadi. There is a question for you, Hamad. It says, Dr. Khalidi, you commented the response of the PA to the crisis at the beginning of your talk. And when you commented later on the PA leadership, you said that there have been serious problems in the way the crisis has been handled so far. The comment is that this seems there are two contradictory narratives of the same leadership. How can we reconcile these contradictions?
Yeah, thank you for the interesting questions. Actually, the chronic gap that we have been facing over the last years actually in top of the political division, it's the governance. So we don't have really clear structure that we governing our health system and even other systems, actually other social and even the economic system. So most of the decisions are not really evidence based. So we need a really consensus on certain strategies and inclusive participatory approach in order to move forward in certain structure or framework of the management on and the government. So I think COVID-19 governance brings importance issues of using technology and investing heavily in the health system and even in the social systems, because empowering the community actually helps the government to attain the national agendas and the priorities. So we need actually leading and mobilizing national collective research efforts for better understanding these actually areas that can bring all players together and on the same table to discuss the strategic issues. So I think we have to use this crisis to put an attention and bring the priority to the concepts of health and public health as a political choice and even human rights. This actually unifies us to act in a comprehensive and holistic approach rather than disparate and scattered governance entities in Gaza, for example, and West Bank. Um, I think this crisis actually gives a great lesson to restructuring the whole governance system and the structuring of the partnership and collaboration between the local, national, and even international, because we need an international role to play a major role in development rather than relief and the humanitarian assistance. And even the government and non-governmental organizations actually to have unified agendas and strategies in order to act in appropriate way. So collective societal response and efforts are really needed. And even we have to use the advocacy in order to be used locally and internationally. So actually after this battle, we have to restart reimagining the whole social systems, including public health system. We have to move from health system to public health system because public health system includes different determinants, factors, stakeholder, disciplines, areas. And actually, it's really a real investment as we invest in the economic, we have to invest in the health because it's a part of it's part of our struggle against the occupation and our supporting our resilience in the situation like Palestine. So these strategic issues and comments or points that can actually bring all people or stakeholders or actors together in order to move forward for a strategic approach for the future.
Thank you so much. We have one last question, as we are short on time. Apologies, we can't answer every question, but we'll try our best, I hope, throughout this conversation. The question says, do we have a political system? No, wait. If the PA had made plans for Palestinian students and or the prisoners, would Israel have let the students in or moved on prisoners' rights? I guess that question belongs to you, Fadi.
Thank you, Marwa. I think, again, the way the question is framed is looking at Israel's response and Israel's restrictions to key things that Palestinians would, agency would allow to happen. I think, again, particularly on the question of Palestinian students being allowed to return, this is not something I would see Israel putting restrictions on, largely speaking, as much as actually the two countries relevant, which are Egypt and Jordan. I think one of the key issues is Jordan shutting down its airport and allowing certain flights to come in, bringing back Jordanian citizens, but not giving the same priority to Palestinians. And I do think actually if the PA had a contingency plan in terms of how to deal with the situation, it could have gone a lot smoother. Right now they are being reactive. They don't have a vision even for how to make that happen. The same thing with the issue of political prisoners. I think there are certain steps that could have been taken to ensure that Israel's response was at least mitigated compared to what it is today. And this has to do, I think, just like Mohammed was mentioning, the preparation that's needed to build our healthcare institute, the investment that's needed to build those bodies. And the same thing, the same type of preparedness, the same type of resources, advocacy should be going to defend the most vulnerable Palestinians and to create solutions for them. And maybe what this crisis puts a spotlight on for us all as Palestinians is, again, what the Palestinian Authority prioritizes and what it deprioritizes consistently. So we see that it deprioritizes the health sector and prioritizes the security sector, which works with Israel. We see that the PA deprioritizes the political prisoners and other kind of key vulnerable communities in our society and prioritizes the economic interest of the 5% of Palestinian elites. And so the answer to that question is basically yes, the PA could have done much more to not just prepare the health sector, but to prepare for defending the most vulnerable in our societies. That would have been more effective, at least than the current status quo. The PA doesn't do that because that's not its priority. And that goes back again to the systematic problems of the Palestinian Authority as a kind of subsidiary to the Oslo occupation framework and not as an actual liberation body. And that's a question that deserves another policy discussion like this one to talk more about.
Thank you so much, Fadi. Okay, I said last question, but there's an interesting one coming up now. And it says, can the mayors of the big cities and villages gain their power the way they had before 1993? So we're talking about leadership, local leadership before Oslo.
So I can start by answering that question, and the answer is simple. Yes, if the mayors are willing to not just take the initiative, but challenge the current PA efforts to control. We didn't delve into this a lot in this conversation, but there's a very clear prioritization that Fatah and the West Bank and the PA have put on always putting themselves at the forefront of any efforts happening, including efforts by mayors and local communities, and trying to, you see this example with certain governors, like the governor of Ramallah, always wanting to be at the forefront of any kind of response, even if it's being done by a community group that has nothing to do with the PA. And so it's kind of, if we want to go to that pre-1993 framework, the mayors have the ability to do that, but they are going to face blowback, not just from the Israeli occupation in this case, but also from the Palestinian Authority that has an interest in focusing, again, the people's attention on a subset of actors that they feel represent their current line instead of broadening it across Palestinian society. And that's why in some places you see mayors willing to take those steps. In other places you see mayors kind of sitting in the pockets of certain PA leaders or security force representatives. And this is, again, a discussion that I don't want to delve too deep in now because of time, but it's another important discussion about how to flip the pyramid of Palestinian leadership to focus more on grassroots local leadership and less on kind of the PA top-down coercive control of society.
Indeed. I mean, lots of questions and visions to explore. And I think we Palestinians have this huge task of imagination and creativity to think about a governance system that really is fitting for our liberation and our right to freedom and self-determination. And I hope that this discussion, goes into that direction, at least of us openly talking about how we can get there and answering all these difficult questions. I know that 1 hour isn't enough. But I would like to thank you so much, Fadi and Mohammed, for joining this conversation. It's really valuable, and I learned a lot, and I hope our listeners have also enjoyed it. Before we depart, I would like to remind our audience that the Policy Lab program is run by your generosity and donations. So please help us to continue this program and the Policy Lab once a month through 2020 and beyond by donating to Al-Shabaka. There is a donate option in this Crowdcast platform. And thank you so much again for joining us. And I wish you a very nice evening or morning wherever you are. Fadi and Mohammed, take care and thanks again.
Thank you, Marwa. Thank you for all of you.
Thank you, Marwan. Thank you, everyone, for tuning in.
Goodbye.
Bye.